Parafricta medical garments work in a unique way to protect fragile and vulnerable skin from damage caused by surface friction and shear. The heel, for example, is particularly susceptible to damage because patients may use their heel to push themselves up the bed, and agitated patients may rub their heels repeatedly against the support surface. If we zoom in more closely, we can picture the various layers of tissue and skin underlying the heel bone, including those carrying the blood vessels and the actively dividing skin cells. The forces of static friction will tend to hold the skin surface still relative to the movement of the heel bone, causing shear forces to pull apart the various layers of the skin, particularly at the boundary between the dermis and the epidermis. Eventually, the skin will free itself from the underlying surface, causing dynamic friction damage as the heel slides, and a further jolting or wrenching as the sheared tissues snap back to their more normal position. This process can be visualized in this animation, which shows that as the heel bone pushes forward, the various layers of the skin are sheared and distorted. The sudden release of static friction then leads to abrupt slippage of the heel, accompanied by snapback of the skin and tissue layers. As this sticking, jolting and wrenching process is repeated over time, the skin eventually becomes reddened, inflamed and edematous. The consequence of such repeated friction and shear insult to the skin can be damage of various degrees, commonly grade 2 ulceration. Parafricta protective booties are lined with a double layer of a unique ultra-low friction fabric. Seen in close-up under the microscope, it is possible to see how much smoother the fabric is compared with ordinary polycotton, such as is used for bed sheets. The double layer of this ultra-smooth material lining the bootie acts as a built-in slide sheet for the heel and foot. Consequently, there is far less friction between the skin and the fabric and between the layers of fabric, causing less sticking and jolting and leading to much less damage to the skin each time the heel moves. The bootie has several additional design features, including ventilation in the toe area, a label for identification, and a non-slip sole to avoid falls as wearers stand up. Most importantly, it is precisely double-lined with a low-friction, ultra-smooth fabric, precision-sewn smooth seams that slides easily over itself to prevent the heel sticking to and rubbing against the support surface. The parafricta bootie has other advantages over using a dressing to protect vulnerable skin. It can be easily applied, easily removed to inspect the skin condition, and can help to retain wound dressings where they have been applied to an existing ulcer. The unique fabric feels cool and comfortable to the patient. It does not retain moisture and is even washable at high temperatures and is hence completely reusable. Thank you.